Welcome back. So measles was declared eliminated in Canada in 1998, but we're now seeing an alarming spike in case numbers right across Canada.
Here to explain why this is happening and how we can protect ourselves are the hosts of the DocTalk Podcast, Dr. Sheila Wijayasinghe and Dr. Shazma Mithani. Thank you so much for being here. Okay, so let's just start off with how crazy it is that we are talking about the measles in 2025.
Yeah.
So what's the situation like in Canada right now?
Yeah, I mean, so as you mentioned, we have not had measles in Canada since 1998, or really like small pockets. It was considered eliminated prior to that. But we are seeing pockets around the world and now in Canada as well because the unvaccinated rates are going up. And so as of just last week, we have over 400 cases in Ontario alone, lots of other cases in other provinces, and they're continuing to rise because of how contagious measles is.
Oh my, it's terrifying. And Dr. Sheila, let's talk about what does measles, a lot of people who've been watching the news have seen photographs.
Yeah.
What does it look like and what does it feel like?
That's a great question. Like, Shaz and I have never seen measles. Like, when we went through medical school, we learned about it as a historical disease, and this is really devastating that we're seeing such a comeback for something so preventable. So the symptoms that we know that you can have about 7 to 14 days after you're exposed, you can develop a fever, you can get a runny nose, congestion, red eyes, and then a classic rash that starts from the head and spreads all the way down the body. And the key thing is that if you are exposed and you're worried about measles being what you're experiencing, please call ahead before going into a doctor's office or to the emergency room because it's so highly contagious that we want to contain it.
Right.
So please call, let us know. Most symptoms are generally mild, but it can be quite serious.
Okay. So, Dr. Mithani, measles is often thought of as a childhood illness, but how serious is it for the general population?
So I think it's important to keep in mind that measles is actually a completely vaccine-preventable illness. And so vaccines are 97% effective if you have 2 doses. It can really be a disease of anybody who is typically not vaccinated. So we think of it as a childhood disease because children under 12 months don't have the vaccine. But because we're seeing a rise in the number of people who are adults who are also unvaccinated, we see it in all populations. So the risk of being hospitalized with measles is 1 in 5. So 1 in 5 people, if you get measles, end up in hospital with complications.
Wow.
Even more severe complications like brain swelling or encephalitis can occur in 1 in 1,000 people. Other things like lung inflammation and pneumonia can occur, and of course, even death can occur, and long-term immune complications too. And so this is not just a mild disease; it is quite serious.
Okay, Dr. Sheila, who is most at risk for experiencing some of the more serious side effects that we were just hearing about?
Yeah, absolutely. So when we think about people who are vulnerable in our population, they're folks who may have a bit of a lower immune response. So we think about babies under the age of 1 year. We start vaccination at 1 year for kids. Pregnant individuals have a lowered immune response, and they also have risks with measles of going into labor early or miscarriages. And then we think about our patients who have cancer, who are on immunosuppressants. And those who are unvaccinated or under-vaccinated, so those who have only had 1 dose, are also at higher risk of developing complications of measles as well. So the key thing is that we have a vaccination. It's our responsibility to protect the most vulnerable in our population. And there's a really easy way of doing it with a vaccine.
And so who should be getting vaccinated? Like, if you already had a vaccine, do you need one?
So 2 doses is considered effective. So 2 doses of the MMR vaccine is considered over 97% effective at preventing measles. Anyone born after 1970 should have 2 doses of the MMR vaccine. If you're born before 1970, it's thought that you probably had measles as a child because it was so widespread at that time, so you're immune from that concept. Anyone that is 12 months or older is typically who is eligible for a vaccine. So at 12 months, you would get your first vaccine. At either 18 months or 4 years old, you would get the second dose. Depending on what province you're in, that time is different. And then that 2 doses is considered fully vaccinated.
So no need for a booster?
Nope.
No, and so there are some situations where you could get the vaccine earlier. You may need an additional dose. So in healthcare workers, they often check our levels. So Sheila and I have had our levels checked as healthcare workers. And so if you are found to not be immune, you would get a 3rd dose because we're in high-risk situations. If you have a child who's at least 6 months old, if you're going to be traveling internationally or if there's a local outbreak, you could be eligible to have your child vaccinated earlier than 12 months old.
Okay.
Got it.
Well, Dr. Sheila, herd immunity is crucial in protecting communities from diseases like the measles. We've seen the rise of measles parties, which sounds ridiculous, where parents expose their kids to the disease to reach that herd immunity. Tell us why that is problematic.
It's very problematic. Please don't do measles parties. As Shaz had mentioned, there are very serious complications potentially of measles, and we have a very safe vaccine that it can prevent measles in itself. So exposing your children to measles on purpose actually puts your kids at risk for hospitalization and possible death. And so this is where please don't do the measles parties. We really depend on herd immunity in Canada around the world. Measles is so contagious, herd immunity levels need to be at 95% vaccination rates. There's parts of Canada right now that are 70 to 75% for vaccination coverage. We need to work together as a community to get our vaccination rates up to prevent the outbreak from happening and spreading.
So Dr. Shazma, if we find ourselves in a community or nearby a community where there's been a measles outbreak, what's your best advice?
Well, the best thing to do is to make sure that you have your 2 doses of your MMR vaccine. So go back and check your vaccination records, make sure your children are fully vaccinated. If you have someone who is under the age of 12 months old or in any of those high-risk groups like Sheila mentioned, it's important to think about avoiding times in tight indoor spaces because measles is so contagious. It can actually stay in the air for 2 hours after the infectious person leaves the room. It's spread by airborne transmission, and so it is extremely contagious. It's actually one of the most contagious diseases that is known to humans. And know what the symptoms are like. Sheila kind of mentioned that as well. So know what to look out for and make sure you're vaccinated. Honestly, that's like the take home for today. Please, please make sure that you have your 2 doses of the MMR vaccine. And that's the best protection that we have.
Dr. Sheila, we only have about a minute left, but talk about how worried we should be that this was a disease that was almost eradicated and now we're seeing these outbreaks.
Well, I think that's just it, Cynthia. Like we've kind of forgotten because we don't know what it was like before the 1970s when measles was really everywhere and the impact that it had. And so this is a preventable crisis. We can do something about it. So we don't want to be alarmist, but we want to support people to make the decisions that are right for their families with evidence-based information like this, that vaccinations will save folks. It'll decrease outbreaks. When vaccination rates go down, outbreaks go up and increased hospitalizations happen. And we all are responsible for our communities and we all have a role to play.
All right, before we go, I have to congratulate the both of you. You have a brand new podcast called the DocTalk Podcast. Talk to us about how you're helping Canadians navigate the healthcare system.
So, I'm an emergency doctor. Dr. Sheila is a family doctor. And so between the two of us, we have a very broad view of the healthcare system. Our goal is to really break things down for the general public, make health topics accessible. So anywhere from measles to menopause to how to stay out of the emerge, we talk about all of those things on the podcast.
Love that.
So great. Dr. Sheila and Dr. Shazma, thank you so much both for being here.
Thank you.
So you can find new episodes of the DocTalk Podcast every 2 weeks wherever you find your podcast, and we will be right back. Don't go anywhere.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.